Dr. Davis, what about people who need their hair need some hair removals in different body parts? It sounds such a simple thing, but apparently it causes a lots of hula hoop. Give us some insight of what equipment exists there, and how effective is it, and how permanent is it? The different things, the different hair removals.
Hair removal is a very touchy subject. No hair removal is truly permanent, and anybody that tells you that it is truly permanent are not really telling you the truth. Hair removal by laser that's good is as permanent as any permanency can be, but not totally permanent forever. You may need touch-ups. Different parts of the body, hair grows at different rates, and you need to always catch the hair in its growth phase. So you need to go to a reputable place that will only do you when you're in the growth phase. Our hair removal machine is very good and one of the few that does all hair colors. Not all machines will catch red hair or light hair. It's very difficult. All machines will pick up dark hair. Our machine does do red hair and gray or blonde or light hair, but it takes more sessions to get it and takes longer to get a more complete hair removal of these lighter colored hairs. We also, if anybody tells you that hair removal is painless, they're also not telling you the truth. Oh. We do treat with pre-treat patients with cream to help reduce the discomfort. We use a topical cream. We give it to the patients, and they apply it an hour prior to the treatment. If you go to a place and they say, oh, we'll just put it on for 20 minutes, it's not going to work. It takes a full hour. And so we tell our patients, put it on for an hour before, and we make sure that they're in the growth phase, or we won't do it because we don't feel that it's doing the patient a service to do their hair removal at a time when they're not in the appropriate phase, because it's just wasting their money, and we will not do that.
I see. All right, so it's quite amazing that apparently simple thing is so complicated, but basically it can be done. Now, how fast does the hair, come back with that laser treatment you do? It maybe different body parts are different. Shed some light on it.
It is. It's very different for every different body part. Under the arms, the chin, if you want the arms done, the back done, the chest done, the bikini, Brazilian area, or the legs. It's different for every body part. And we find that it's different for different patients.
Right. But what's a good range? What can the average patient expect?
4 to 6 weeks. 4 to 6 weeks is average, depending on the body part.
So every 4 to 6 weeks you kind of have to go and do these procedures again. Is that what you're saying?
Right. Correct.
If you want to be in macular condition.
Right.
Okay.
Right.
Okay. So and this basic procedure, is that like duct tape over and then pull it off like no?
No, it's a zap. You feel a zap. Actually, it does. It feels like a zap. It almost feels like you're taking a rubber band and snapping it. Okay. Is what it actually kind of feels like. The best way I can describe it.
Okay. Well, I'm glad that there's some better technologies out there for the people who want to get need some hair removal, and I'm glad I'm not part of them. I might soon need the opposite. I might need some hair growth soon. Who knows? Right.
Good.
Well, thanks a lot, Dr. Marsha. Thanks like always.
You're welcome.